A good friend of mine from a long time back, and we've known each other about 15 years or so. And Brian is the CEO and founder of Principal LED. And Brian, I can't explain it better than you can. So why don't you explain to everyone in San Angelo who wouldn't understand what Principal LED does? How would you know what a Principal LED is or what you do?
Yeah. So like you said, I own the company, and my brother Blake, we own the company together. A lot of you guys probably know Blake as well. We manufacture LED lighting, and the market. We're kind of one of the bigger companies maybe a lot of people in San Angelo don't really know about because we don't sell anything locally. Mm-hmm. We actually, we're a manufacturer of LED lighting, power sources, any kind of electrical component that a sign manufacturer would use to build an illuminated sign. So we're actually the largest provider of LED and electrical components to the sign industry in North America. So, we have our little niche. We've been in this niche for a while.
San Angelo LED lights around.
It is. We actually we started with Loves about 5 years ago. They're out of Oklahoma City. Great company, great people, and we started a process of retrofitting all of their locations, and it was a kind of a 5-year plan to take all of their existing locations and retrofit them completely to LED. Anytime you see something that's illuminated on a Love's.
So when you see a Love's, I mean, they have I guess the cowling all the way around the top of the building.
Yes.
I always thought that was fluorescent lighting.
Yeah, and historically it was. And what we did is we actually have a patented product that, in fact, we have several patents that covers retrofitting a fluorescent to an LED.
So if your ballasts go out, it's time to just retrofit it.
Yeah, it's a good time because, and we tell even small businesses, if you're going to pay for a service call, and you're paying for a service call every year, if you know what it costs to have a bucket truck come out and just replace the fluorescents, it could be $700 or $1,000, and you may be doing that every year depending on where your location is and how long it takes. Wouldn't you rather spend $2,000 converting it to LED and not have to touch it for at least 5 years or longer?
All right, so LED, you've been fascinated with LED lighting all your life. Right?
Well,
I mean,
all my life.
I met you back in, back in
03 or
I don't know, it was back when you had just started Agilite, which is, I guess, a precursor company.
Correct.
So you're kind of like me. I kept on banging my head against the wall in the news business, and you were like doing no, LED lights mean something,
Yeah.
And so you had a startup. We both had startups in the Concho Valley Center for Entrepreneurial Development,
right?
CVCED.
That's right.
Which is, that's kind of a cool thing because San Angelo actually, seeded these kind of ideas. But how to explain just talk about how did you get into LED lighting? Because I mean, by the way, he's a pretty smart guy. He went to A&M. First of all, that means he's very smart. But
wait, I'm a Ram first. I went to Angelo State undergraduate, PhD
right.
at A&M.
He went to ASU as undergrad and then A&M, and you got your doctorate at A&M.
PhD in analytical chemistry.
So chemistry, huh?
Right.
And it has a lot to do with LED.
Well, material science, you'd be surprised how much there is overlap, and so it's kind of a weird story. I was working for Dow Chemical, and they had a advanced electronic materials group, and I ended up moving into that group, and that's where I learned kind of about LED technology. But
now back then was what, late 90s, early 2000s?
Yeah.
What was LED like back then?
Well, they were in toys, light up kids' shoes, and a few indicator applications. And there was some interest and some ideas that the sign industry might be the first area that could adopt LEDs, primarily because of the issues with neon in terms of the voltage, breakage, a lot of
all the things you're talking about as being great I guess, benefits of what you're
Right.
doing now.
Yep.
The breakage of the bulbs, the burning out of the bulbs, the ballast going out of the fluorescent lighting.
Absolutely. Now, I do have to give a little shout out to Neon, because we actually bought a Neon components company in 2015 and have incorporated it's called Ventex as part of Principal Lighting Group. So we still support that piece of the industry. There's definitely the size. I remember when I started in the LED industry, we had our little 8x10 booth at the big international sign show, and the big neon guys were everywhere. And 15 years later, it's the LED guys with the big booth, and there's one or two neon guys left.
And they're just more like they're for
It's
legacy.
specialty, and there's a place for neon in certain exposed neon look. It's hard to replicate that look with LED. There are faux neon products out there that do an okay applications. You'll see them in chilies and some other applications. It's the market changed a lot, and in 2003, we were kind of storming the beach at Normandy, just trying to stay alive because we were so early. But I tell people, they say, how they look back and say, oh, you must have been so smart to figure all this out. And the fact of the matter is, my brother and I were just stubborn. We just kept at it and had a certain level of persistence that over time paid off.
Right.
I mean, as the market, we believed that this market would grow, and we just kind of stuck with it.
What was the kind of like the moment when it really broke out? Do you or maybe there's a couple of times?
Yeah, it was 2 times.
Okay.
So I would say in 2007, about, and as LEDs started to become more popularized in general lighting applications, that helped drive the cost down to a point where all of a sudden there was sort of a tipping point where the math made sense
So
to
they were
replace
putting it in
neon.
like household lighting, I guess.
Starting to, and so the volume of LEDs was growing, and we were able to get our manufacturing costs down to build a whole module. To give you an idea, so when we started, I think LEDs, the going rate, we sell by the foot.
Right.
Was maybe, call it 100 lumens a foot, and or it wasn't even that. It's probably 80 lumens a foot, and no optic, just a circuit board. Those products would sell for $15 a linear foot in white. Mm-hmm. Today, they're under $1 a foot, and they have an advanced optic on them. So we lived that. I mean, talk about living in an industry where you see 90% price reduction over a decade. Is you have to understand, you have to stay up with technology, and you got to kind of lead the way.
And the volume has to
come with it.
Come with it.
Yeah. I mean, I laugh because we fill up, an entire freight truck, and that would have been $1 million worth of product, and it might be 40 grand now.
So back in 2007, it's $1 million.
Yeah, maybe, or 2003. Yeah, so it's changed. The market's definitely changed.
You're in the manufacturing business, and with this, with the COVID-19 and the coronavirus and things like that, there's a lot of discussion about whether or not we should be importing stuff from China.
Correct.
Or we should be using, basically we're using China as this giant factory farm.
Right.
And we're building everything there. So talk about, importing stuff from China. Where do you think it's going after the virus clears?
Sure. So when we started, first of all, for a number of years, there's, especially for electronic materials, there are other industries where there's more supply chain infrastructure for in the United States. It's been historically outsourced since the 90s, right? I mean, you start to see computer makers and everyone sending all their electronic materials first to, countries like Taiwan, South Korea, and then eventually over to mainland China. So all the supply chain for the electronics industry was over in the Pacific Rim.
Right.
We always did business in Taiwan. We've had great relationships there, great people, democracy, good ally. We can talk about that, and they've done a great job, by the way, with this COVID-19 situation. It's amazing what they've done.
So you're outsourcing a lot of your manufacturing to Taiwan?
Well, we did, and then more of it shifted to mainland China. But about 2 years ago, even before this whole tariff situation came up, I had this crazy idea of saying, you know what, we want to put our destiny in our own hands. And I was looking at some of the new technologies that are available in terms of automation, robotics, SMT equipment that would allow us to possibly bring that manufacturing back to the U.S. So we started that process, and then the tariffs hit, and we accelerated the process. And today, you know, we still do manufacturing in Asia, but a bigger and bigger percentage every year and every quarter, we're pushing our manufacturing right here in San Angelo. So if you came by our facility, which is out in the business park, you know, we have 60,000 square feet under roof. We have probably one of the best fully automated surface mount pick and place robotic systems in the state for sure. You know, robotic soldering machines, overmolding machines, and so.
Well, a lot of people are going to be looking at bringing their outsourced stuff into insource, I guess.
Yep.
What's the cost and the cost benefit analysis? What was going through your head on figuring out, well, do I need to buy these robots?
Yeah.
If I buy them, am I going to be, shooting myself in the foot competitively?
Yeah. Going and reaching out on a limb and spending $3.5 million, which is what we spent to bring manufacturing back to the U.S., that was a big decision for us, and it had risk associated with it. But you know, you also my experience just philosophically is every mistake I've ever made in business has been driven out of a 4-letter word, and it starts with an F. It's fear.
Fear. Okay.
You know, and I've tried not to make decisions, and Blake and I've tried really hard not to make decisions based on fear. Instinctively, if you know it's the right thing to do, you need to press forward with it. And we felt like, you know, the timing was right to start bringing our manufacturing back here. And we did. We still have our challenges. You know, we're not at the level of production that, you know, full production yet, but we are producing, you know, complete modules, complete LED systems right here in San Angelo.
Does it give you more flexibility as far as product development?
Yeah, so for us, it definitely for product development. The challenge is the supply chain on some of the other stuff. You know, circuit boards, we're still having to import from Taiwan. We can get wire. We buy wire from a company in Dallas. But in terms of product,
you're kind of like transitioning between outsourcing everything to assembly here and seeing what else you can put together.
Yeah, but it started with assembly really of our stick products. That's where we really, and what we realized when we developed this little stick product was.
What is a stick product?
All right, so these are the retrofit products that replace fluorescence.
Okay,
so imagine it's LEDs on a stick.
If I have a sign out here in front, which I will never put a sign out in front, but anyway,
I don't blame you.
And it was fluorescent. You have a stick that I can transition from the way how it plugs in, the fluorescent ballast plugs in, to change the voltage to DC, I guess.
That's it. So we made a really simple way a sign maker can take out an existing fluorescent, put this LED product in, wire it to a power supply, and be done in a pretty short amount of time.
Right.
So what we realized though was signs have all these different depths, all these different heights. Some are really deep, and if there are literally hundreds of different SKUs you would need to import if you were trying to import a product like that. Well, what we thought, this is going back 5 years ago, 6 years ago when we started this, was, hey, we realized that we could make a product that we could build just in time, assemble just in time here in San Angelo. And so what that allowed us to do was, instead of having to carry a bunch of inventory, we could small family businesses, or certainly businesses with less than 50.
Right.
And so they manufacture in the U.S. and they certainly want to buy products if they can that are made in the USA.
Connected with that.
Yep.
Yeah, with this bringing in more manufacturing assembly here in the United States. What do you think it's doing to our job market in our productivity as a country?
Bringing more jobs back?
Yeah, do you think it is? I mean, personally, with your company.
Yeah, I mean, it's been great. I mean, we went from, I mean, when we were outsourcing that, we still had a lot of inside salespeople. We had a lot of customer support, engineering, but, we went from 50 employees to over 100 employees just by manufacturing. We probably created, between the assembly and the manufacturing, 40 or 50 manufacturing jobs right here in San Angelo.
So it does work.
It does work. Absolutely, it works. In fact, we need to be doing more of it. And what businesses have to make here's the thing is, we looked at it as we might be willing to give up some short-term profit in order to keep our destiny as much as we can in our own hands, and do some stuff to, make a difference in our, in this country. So in the long term, it's going to pay off. And if companies really think about it and realize that, that'll start driving changes in behavior. But unfortunately, we've had just a culture of outsourcing everything to the point that we've created an economy in the United States that's based on consumer spending only, which really scares me a little bit about this coronavirus situation.
It's hurting the consumer spending. I mean, every advertisement on San Angelo Live is about, B2C.
Right.
They want consumers to come to this bar.
Right.
Or they want consumers to eat at this restaurant or buy this car. And that is scary, because I really thought about that. I mean, how vulnerable, our business model was to this whole COVID thing, because we're so based on consumer spending.
Well, and the fear is, I would hate to be any governor or the president or any leader trying to decide, we shouldn't politicize this thing. I mean, it's awful. I feel horrible. I have friends, I know people that have been impacted who not just their businesses, but also, have contracted the illness. Because we have customers all over.
Right.
I was talking to a guy in Queens that we do some business with, and he's literally in the epicenter of the epicenter, and it's horrible. But at some point we have to, and I don't want to be this person, right?
You don't want to be the guy who makes the call?
I mean, it's a tough call, because at what point do you say, I know I'm going to have to give up some lives to prevent us from going into economic collapse, right? I mean, that's really what it gets down to.
It's if you're in government, it's a trade-off between two types of policies. I mean, you have health policy and you have economic policy, and there's trade-offs.
But I would argue that economic policy can also impact health.
Right.
You look at everything from suicide rates to quality of life to the ability to buy medications and afford medications, domestic violence. That economic impacts also have a health impact and can long term. So right now, I feel the people that are feeling this the worst are your business to consumer folks, your bars, your restaurants, your retail industries.
Well, retail, actually, some retail's pretty good.
You're right.
Walmart is killing it because, Walmart's a distribution system. I mean, that's really what it is, and that's what we needed to get through this. So they're doing okay. But, I mean, what about your non-essential retail, your toy store, or your, florist?
Yes. Yes. I mean, even our business. I mean, we sell components to manufacturers of signs. Well, they support retail. They support, and if these guys are at home, I mean, our business is off probably, it's stayed pretty well, but it's off at this point probably. This month we're trying to forecast maybe it'll be off 50%, maybe a little
50% down.
And so we're feeling it. Now we've made all the necessary, precautions and things we needed to do. I mean, one of the things, we did is, we looked at the top down, and I did it in a progressive manner. I hate using that term, but I'll use it. Basically, we said, the people that make the most are gonna have to sacrifice the most for a period of time, and so we have a plan to
Have you kept everyone fully employed, or how's that?
Yeah, I mean, we have reduced our workforce by about 10%. But other than that, we don't anticipate any more cuts. We see once we come out of this, we'll we'll kind of restabilize and start adding people again. But yeah, and there's nothing worse as a business owner to have to let someone go that's done a good job for you because of a situation like this. Because in many cases, it's sometimes no fault of their own.
Now you're taking care of a lot of this with the government programs that are available, the PPP loan and things like that.
Right. So the PPP loan, we have applied for, and we've gotten approval. We haven't gotten the check yet. But the PPP loan will allow us to continue to have people employed, and that's what they're really saying is we don't want businesses cutting people any further. So this allows a period of time for people to keep folks employed, but it's not going to last that long.
And the way I look at it, I mean, my sales are probably down 40% right now.
Sure.
And I don't know what it's going to be this month. It'll probably be bloody.
Right.
Last month was okay. We were, they didn't clamp down until the end of the month, and everyone's like, "Oh, my advertisers said, oh my God, we don't have any customers."
Right.
Now we don't have any customers this month. That's what my clients are saying.
Sure.
So I mean, we lost all the restaurants, all the bars. They're gone, and what I told my guys is I'm going to keep them employed through. I mean, you're going to have a paycheck through June 1st.
Yes.
And we got to figure out something else to do if this thing continues.
Yeah. I think entrepreneurs and small businesses are feeling this the fastest, the hardest.
Right.
And I want to give a little warning to our folks that are in jobs that are maybe federal jobs or state jobs. The ripple effects from this, I think the entrepreneurs might start and the small businesses might start recovering, but depending on the speed at which this recovery takes place, it's going to impact our tax base. We've printed a lot of money in this country that could result in maybe long-term inflation. I'm not talking in the immediate or near term, but budgeting's coming up in the fall. For universities, for
local governments.
For local governments, and what they're going to find is
no sales tax.
No sales tax. No, in some cases, people have lost their jobs. Well, in the federal level, if you have 15% unemployment, not only are they not paying taxes, they're actually drawing unemployment. So the next wave of this is going to be, significant budgetary cuts across our entire government. And basically public sector workers. I think.
You don't think they're going to have a public sector bailout? I mean, that's pretty much what they did during the financial crisis of 2008.
Yeah, I mean,
they could.
You could print some money, a little bit more money, but again, it all depends on how fast the recovery takes place. Every week that people are, basically not working. Is probably a quarter that takes us to get out of this. I don't know if it's a quarter, but days start becoming months.
Every week we're not productive. You're thinking it's going to take 4
couple months, 3 months.
Yeah, 3
I don't
months
know, but it's going to take something, right?
But you're saying productivity is what drives growth.
Yeah, I mean, think about the Great Depression. Right. Let's say we get into a deep recession in this, or let's say we even move into a depression.
Right.
Okay. How did we get out of the Great Depression?
Well, some people say the war, but not really.
I mean, somewhat. I mean, it was based on we made stuff, right? It was productivity. Well, when you have an economy that's based on consumer spending, consumer spending, and all of a sudden you take away the consumer spending and you have no ability to build anything, to create anything, it's going to be very difficult to get out of that. And at some point, the government runs out of bullets.
Right.
So that's the scary thing. I mean, that's the thing that people need to understand is, and so the question becomes from a health policy, everyone needs to take the politics aside, right? And say, how do we get at some point people back to work and do it in a way that is as safe as humanly possible, right?
Or takes less risk.
Absolutely. In other countries,
least risky, I guess you could say it.
Yeah, and some other countries have done an okay job of doing this, and we need to look at some of those models and think about what they did and how they implemented it. Now, you can't compare, Luxembourg or to the United States, or you can't compare, so you can't make those one-to-one comparisons always. But there are some things people have done that some of these countries have done that have made a difference.
Anytime there's something like this, a major there's always opportunities for coming up with new ideas, new concepts.
Yeah.
Now, I know you got one invention out of this deal. So,
well,
explain to him what this invention is. Is Manny there? Manny, show him this. Is the invention there? You know what I'm talking? It's the light that.
Yeah.
We do have the.
It's the light.
Yeah. So I have this major problem of having a lot of things in about 75 or 80% completion state. I'm sort of right-brained, and this is one of those things we kind of put on ice because
and this is years ago you put it on ice.
Oh, about it. Actually, we were looking at this earlier last year, and we kind of put it on ice because we just we were so busy with our sign components business, really didn't have time to focus on it. But we were working with our partners over in Taiwan. We had worked with them on developing this device, had it SGS tested, which is a global laboratory that does certifications of products for its efficacy in killing different pathogens. Now, at that time, COVID-19 didn't exist, so we didn't test it for that, but tested out really well.
So describe it.
Yeah, so it's basically a hand, I should have brought one, but it's a handheld, looks kind of like an iron, and it's a handheld device. It's for commercial and industrial use.
Okay.
We're not really trying to promote this and sell it for home use simply because we've got enough people on the commercial side that need these, and we have kind of limited supply and limited manufacturing capability. But the idea is that, I can tell you where some of the hospitals are using it. It's got a switch on it, you turn it on. I mean, you have to wear a pair of safety glasses. I mean, good thing is with polycarbonate, we'll filter out 99.9% of UV light, but this emits these UV LEDs emit in what's called the UVC region, which is the germicidal region of the spectrum. So that region is known to kill viruses and bacteria. And so it depends on, and by the way, you can go on Amazon. The first thing I did is, when we put these out, someone said, well, I can find one for $79 on Amazon. It's like, okay, if you're a germaphobe, you want a toy to make you feel better, and you've got an hour to sit around and clean your keys, then you can use that. But I mean, the idea is that this is for high throughput. If someone needs, you got a line of people that need to sterilize keys, keyboards, and do it in a fairly short amount of time.
You can also do like a hospital room, I guess.
Yeah, I mean, to do the full room, there are specialty products already designed, and they're anywhere from $30,000 to $100,000 that literally you can roll into a room, and they're really high power. They're based on high power UV lamps. They're not based on LED, and can literally, you walk out and you leave it in there, and it sterilizes most of the room, or as much wherever the light is exposed to. This is more for smaller stuff, but we're seeing a lot of hospitals. I know. I've been working with a couple of the doctors over at Angelo Community that have set up a system because they are so low on PPE, is to be able to, re-sterilize or help disinfect some of their PPE so that they can extend the use. And that's how they were using it in Taiwan and other areas when PPE was in short supply. So there sort of became a need, and we thought, let's see if we can get some of these produced to help.
So you've been giving them away? You've been selling them?
We sell them, but we've given a couple of them away, some of them away. But unfortunately, we're selling those. Now we've given away a whole lot of masks, and we've given away a lot of other things. But yeah.
All right, so let's talk about the masks. So you and Intertel?
Yeah. Well, before we get that, the UVC, if you gave them away, everyone would want one and say they had a need for it, and so we are selling.
And you call it, what is it called, UVC?
Yeah, it's our UVC LED. Yeah, actually, if you go to Steriled, STERILED.com.
All one word?
All one word.
Steriled.com.
And by the way, I own that website from several years ago. So I tell you, I have this stuff in different stages.
Yeah, there you go.
So it's like we just fired up the webpage, but yeah, you can go to that
look
website,
at it and check it out.
Look at it, check it out. It's got all the data. That's one thing that's really unique about that product. It's actually, we actually publish the data in the data sheet that shows its efficacy.
How much does it cost?
It's $1,250.
Okay, so it's not out of reach.
No, and I mean,
but for the guy with the home, probably
yeah,
not.
probably not. And quite frankly, we're trying to, where we do see interest is a lot of businesses have bought these or pre-ordered them. Our first manufacturing shipment will be ready to ship on, I think, about 10 days from now. So, but we've seen a lot of businesses that are like, okay, I want to protect my employees, and so I want to be able to kind of sterilize documents, mail, incoming packages,
Right.
stuff like that.
Right.
Yeah.
So your secretary at the front can go over everything that comes through.
Yeah.
Interesting.
Yeah.
So what's the URL again?
Oh, at Steriled, but all one word, STERILED.com.
Okay. Steriled.com.
Yeah.
There you go.
So and we're seeing some good results. There's fortunately we had a lot of cooperation with different healthcare entities that are giving us some test data and how they are using the devices. So it's been a really good that we're able to get this out to market at the time that we did and get enough of them out there so that we could do some testing. And now we have a limited production, but right now with such a short supply of everything from PPE to just the ability and need to be safe.
We're finding a lot of people are adjusting their if they do. I mean, you obviously the most basic one is the restaurant doing the curbside.
Yep.
Like a sit down restaurant doing a curbside delivery. But like we had the brewery in Brownwood, the Teddy's Brew House, and they started doing creating hand sanitizer in their brewing machinery.
Correct.
And you have this LED light. I guess, what do you call it again?
It's an UVC, so
UVC.
ultraviolet C.
I'm going to just forget. I mean, you need to
LED sanitizer, you can call it.
LED sanitizer.
Yeah.
We need to come up with a cool name for it.
Yeah, we're not. That's not always our strength.
Live light. Yeah, live light.
Live, good name. Where'd you come up with that, Joe?
I don't know. I stole it from something. Anyway, so you're also doing some, I guess, philanthropic work with LED or with masks.
Yeah, so working, about I'll say several months back, before really the pandemic came to the U.S., it started breaking out in Taiwan. And my buddy called me and said, "Man, can you get me some masks?"
Your buddy from
my
Taiwan?
buddy from Taiwan. And I said, well, I can go look on Amazon. And sure enough, I mean, they were available on Amazon. No one in the U.S. was really buying them. So I bought some from him and I shipped them to him. And so they were using them, and the way they used them in Taiwan, which, by the way, I'll get to the philanthropics part, but I want to make a point that if you look at the Czech Republic, if you look at Taiwan is really close. If you don't know where Taiwan is, it's basically, it's all the pre-communist guys who, as the communists were taking over, took off and went to an island nearby, and at the time
it was a short boat ride.
Short boat ride.
Yeah.
So they have a lot of flights in and out. I mean, they're in and out of
China?
Shanghai, Hong Kong, Beijing, all over China. They do a lot of business back and forth with China, and they only had 50 cases.
In Taiwan?
I'll have to check the exact numbers, but I only think 1 or 2 deaths. They got it under control early and fast, and they did some things that maybe we can't do in the U.S. But they one thing that they did do, which I'm a big proponent of, is everyone wore a face covering when they were in public. And I know 3 weeks ago or a month ago, the CDC was saying, and the Surgeon General was saying, don't do it, we're not sure it works. But keep in mind, there was a concern over supply at that point. I think that they've all come back and said, yeah, it's a good idea. And really, this gets to a citizenship thing. I hear people saying, the government's not going to tell me what to do. And you know me, I'm a capitalist. I have as many libertarian leanings as anybody. This is not about politics or someone telling you what to do. This is about citizenship, and which they used to teach in school. I don't know if you remember when we were in school, they taught citizenship, right? It's about how do I as a person take care of those people around me. And a lot of people think, if I wear a mask, it's to keep me safe. Well, that's not why they did it in Taiwan. That's not why we should be doing it. If you wear a mask, right now, look at a study from Iceland, said up to 50% of people who tested positive for COVID-19 were asymptomatic. And sometimes you can be asymptomatic for a couple of weeks.
Before
Which
you
means
can
right
tell
now, I could be sitting here and we're probably, I know we're 6 feet, and now they're maybe even recommending more, but it's kind of hard to do this with a mask on. But they're recommending that they've discovered that it's really about keeping you, if you have the virus and don't know it, from giving it to either people in the community, someone you love. I mean, the traveling distance is really high of this, and it's highly contagious. So in Taiwan, they wore these masks, and that's he said, you know, I'm giving one to all my employees to wear. And he said, you know, that you have to come to work, you got to wear a mask. There's not because they went through SARS and some of this other stuff. There's not that stigma associated with putting a mask on and walking around in public.
Right.
So if we want to get this economy opened up, if we want to get able to move around, we've got to figure out a way to be able to move around and be as safe as we can. And wearing masks in public is absolutely, I mean, wearing masks when you're going to Walmart. I mean, I see people all over town walking up next to each other, no mask on, you know, and it's just, it's careless. I mean, I wish I could say it in a different
not careless
way,
yet, because most people don't know where to get a mask.
Right.
You know?
Now that you can go buy, you can make your own face covering, and that works.
Bandanas work?
Bandanas work. I mean, anything will work. So with that being said, I started a couple weeks ago, started looking at what if we could bring some masks in and help give them away. And I started talking, I talked to Intertel, I talked to the city about it.
Intertel is a security
company here in town, and we were already doing some stuff. So, you know, if you guys are familiar, I'll show you. It's a contractor version of it, but it's an N95 respirator type mask.
And this is what they use in hospitals.
This is what they use in hospitals.
So a nurse would wear that.
A nurse, a doctor. Yeah, this is what you really need. This is what they're concerned about, being in very limited supply.
The N95 masks.
N95 masks.
Right.
Yeah. So these are you know, between Intertel and ourselves, we've brought in and are bringing in about, and quite frankly, Intertel's doing even more than we are, but about 60,000 of these to provide to various healthcare facilities around this area.
In the region?
We're doing some in Abilene. We have some relationships up there. I know, and some can pay us for them, but you know, there's some clinics and smaller things that need them that we're giving them away to. So our idea is that, first of all, we got to protect our frontline health workers. And so we've been giving these away. Some people have said, you know, I heard that, you know, they're giving away, Principal LED and Intertel and the San Angelo Health Foundation are giving away 100,000 masks. Well, I thought these were in short supply. Well, we're not giving away these masks. These are the types of masks. In fact, we are giving these masks, and getting these masks in it's pretty difficult to get these in.
But you're kind of reserving those for frontline
health. So that's not what we're talking about. But we had this idea of just a face covering. So if I cough, you know, it's not reaching 15 feet away, two aisles over in the supermarket.
Right.
So what we did is we purchased, and I just got confirmation that they're shipping today. So right now air freight is insane. So trying to get it all coordinated. I mean, imagine there's limited planes and limited stuff moving around. But we have 100,000 of these that we purchased, and we're working with the city to come up, and the city's going to come up with a distribution plan.
I'm sure they should put it on camera.
Yeah, so this is an ear loop face mask, just a basically disposable mask. But if you're like, I have one, I just grabbed a new one, but I have one that I've been wearing that, you know, when I go out, I put it on.
Is it made out of paper or what?
It's kind of a cloth material. Yeah, and it has an elastic band. So when you put these on, you know, you basically put it over your face like this, and you sort of can stretch it out. And forgive me, I'm not a healthcare worker, but kind of pinch the nose here, so it creates a seal. So as I breathe, it gives you as tight a seal as possible. Obviously, you have a beard, it's going to be less effective.
So shave your beard off.
Shave your beard, man.
Yeah,
What's more important than that big long beard or living? But the idea is that we had this idea of we want to give one to everyone in San Angelo. There are people that can't afford, you know, masks, don't know about it. So our idea was come up with a plan with the city where we can get these out to our citizens. And I just want to encourage you, you know, if you're in San Angelo, please wear a face covering.
When do you think, you have them on a boat coming over here, or you got them on an airplane?
They're on an airplane.
They're on an
FedEx Air. So that ain't cheap.
You're FedExing 100,000 masks on a, how much of an airplane does that fill?
I don't know. I think it was like 100 and something cartons. I don't know how big a carton is, but it's a lot of. It's
so it'd be one good airplane through Memphis.
Oh no, yeah. I mean, we could probably get 100,000 to them in this whole studio area stacked up. I'll see. I didn't do the dimensions, but it's a lot of weight. But I didn't want to wait because right now, if we and the Health Foundation really stepped in and helped cover a big chunk of the freight costs to get these here.
How much is it to freight that stuff from China? Roughly?
Well, the quote around 15 to 20 grand, 15 somewhere in there.
My goodness, and they're
15 to 20,000
from China.
Yeah. So it's not cheap. And in fact, getting these is so what's happened is not these I'm able to get out. These were interesting because the Chinese government on the N95s has been sort of playing games with not wanting them to leave the country. And so I said, it's like I'm exporting blood diamonds. We had to move these through a courier in Hong Kong so that we could make sure we got them out of the country and got them here. I mean, so we really were concerned. Now I've just got tracking finally on all these. And I think the first part of the shipment, the latest shipment is going to be here I believe tomorrow.
Cool.
So, I mean, but this is what's in really short supply and doctors need. I mean, if you guys have extra of these masks in a box that you haven't used, go take them to community or take them to, La Esperanza Clinic or, these, you say, well, we don't have that many cases in San Angelo, but you have to realize the bidding for these is nationwide, even worldwide.
Right.
So all the PPE is just getting sucked up everywhere. With us only having, how many cases of COVID-19 confirmed we have, Joe?
In San Angelo, we have 35.
35,
and up until 2 o'clock, and today is the 13th of April. So at 2 o'clock today, they'll announce the next round.
Okay.
So 2 o'clock's kind of
4 new cases today.
Got 4 new cases today, so we're up to 39 total cases, of which yesterday I think 23 had already recovered. So
you notice we're getting more, and the reason we are, there's a UT, and I shouldn't say.
Did you say UT?
UT study that so
UT.
It's probably okay.
You think it's okay?
Yeah, well, I'll trust it.
All right.
It might be a little exaggerated, but they said basically that if you have basically 100 people, right, that have confirmed, you probably have 10 to 12 times that. I don't remember the exact number, but about an order of magnitude more people for sure. And I think that could be low because just the virulence that they're finding out and the fact that so many people just don't show symptoms or asymptomatic.
I think another thing that really impacts it, if you look at Abilene's numbers, they're a lot bigger than ours. I mean, a lot bigger. And I think what happened there is they had a healthcare facility there that ran through a whole bunch of people who were staying in a residential area,
right?
And that drove their numbers up. So I think that also you can see how that changes.
Yeah, definitely. It definitely will have it impact earlier. So what that really means, not so much is that our numbers aren't going to get that big. It just means we're later on the curve, which means if New York's peaking out today, we're going to peak out. Abilene might, or somewhere in the Dallas area might peak out May 1st. We in San Angelo might not peak out until May 15th, because now that we're starting to have community spread, we will go through that distribution curve. Obviously, we want to flatten that, but our peak is going to come much later. And that's why I really want to get these in. Really want to encourage you if you can make your own face covering. I think we have a unique opportunity in San Angelo to be different and say, you know what, we're all going to do our part to try and really slow this spread in our community. Because if people will wear these, if people will do the social distancing, the hand washing, and use a face covering when you're in public, I think we can really knock this thing down. We're still early enough. If we really get serious now, we can knock this down. But if the cases, even with social distancing, are doubling every, I don't know, few days, week, depends.
Right. But it seems like all the new ones are all community spread. Isn't that right, Manny?
Yeah, Bobby Root on our Facebook comments has asked, I would like to know why they're not taking temperature checks before coming inside stores. So,
great question. So the question, could they hear that?
Yeah.
Oh, okay. So in Taiwan, one of the things that they did, I said, well, how did they open up the economy, keep the economy open, only get 50 cases? I said, what did they do at restaurants? I literally asked my buddy, and he's like, oh, you could go to a restaurant, you had to have a mask on everywhere. Everyone had to have a mask on. But when you walked in, they squirted you with hand sanitizer and they checked your temperature. So I think we can release parts of the economy where we're not having massive outbreaks, right? But you have to do it in a way that's safe, right? And so that's the way they handled it. They actually had temperature checks. Now we do temperature checks at our facility. We're really spread out now, but as an essential business, everyone has for several weeks has been wearing a mask if you're in our facility, and we don't regularly just go around checking temperatures, but we have the ability to do that, and we've done some spot temperature checking. So I think it's a good idea, and I know it feels weird. It feels like it goes against like our grain as West Texans to like have somebody come.
As Americans,
yeah.
Well, I went to a doctor's office to do some work, and the first thing they did, you got to get screened in. You can't come in. And they shot my head with a machine that told me that I had 94.7, which is lower. So I figured it must be detecting I'm cold-blooded. Yeah,
jokes. That's true.
I got jokes.
Yeah. I mean, and look, this is, and I get it. People are at home and they're like going stir crazy. And
watching too much. The Netflix are not coming out with enough programs.
The animal, the Tiger King guy's in jail. There's nothing new to make. But I just want to tell people, first of all, we're going to get through this. San Angelo will get through this. This country will get through this. But I first of all, if you want to contact me on Facebook, you can't, because I'm not on Facebook. But I think our company has a Facebook page. I see my wife will share with me some stuff on Facebook, and I just see the level of, I don't know if it's vitriol, I don't know what. People are just so angry. It's like, instead of looking for an opportunity to, hey, how can I help? Let's just criticize. And I blame somewhat of our government. We've had this sort of, this situation where anytime anyone has an idea, it's let's be critical, let's talk about why it won't work,
right.
And there's a level of cynicism.
And also tell them how stupid they are for thinking it would work.
Right,
you gotta do
right.
That too.
And I just my prayer and hope is that we go back to this idea that, especially right now, that we want to be good citizens, that we want to sacrifice. I mean, we're coming off Easter, right? Let's sacrifice a little of ourselves. I'm not saying that we take people's freedoms away. I'm not up here saying, you can't, but if you want to have a job down the road, the more we do this,
learn
the faster we will get over this. And the more we hand wash, the more we social distance and do those things, the faster we can get over this. If we can be safe, at Walmart or at, I just drove through, as an example, I was kind of late for lunch because I was coming over here and I had 2 other conference calls. So, I have this weakness for Taco Bueno. So I went through Taco Bueno, and I'll give them kudos. The guy had on gloves and a face covering. And, I was like, hey, I'll patronize, a place that's doing that. Look for places that do that. I'm not saying we shame our restaurants into, but the fact of the matter is,
there's nothing worse than getting shamed over the virus.
Yeah, I mean, if you're handling food in any way or dealing with the general public, you should be wearing a face covering. And right now it's not mandatory, and my hope is that we don't have to. I mean, I don't know if the city's going to pass an order or anything saying that.
I think it's going to come down. The president tweeted this morning to get ready for face masks.
Yeah.
So I think it's going to be CDC guideline. The governor of Texas will pick it up, and then
Well, that's kind of why we saw this coming, and I'm glad we started when we did. Because if I was starting this today, trying to get 100,000 face coverings would be a challenge, because people are going to be scrambling for them, especially when the general public's being asked to wear them. But there are ways to make homemade masks. I know there's a lot of people locally who are just doing an incredible job of. I know we donated some plastic, or trying to help with some people that are trying to route and cut plastic to help make face shields for hospital employees because
Okay.
there's a shortage of these face shields. I know a lot of people who are sewing and making face coverings and giving them away, and that's just awesome. I mean, when I see that, it gives me some hope that
The
there's
world
still
does
some
not
good people.
It doesn't revolve around all the vitriol on Facebook.
Well, I've always said when a crisis happens, one of two things happen. People either get calm and they become a good Samaritan, or they get really selfish and go absolutely crazy. If you've ever I've been on airplanes where the alarm's gone off on a plane,
Right?
and people only respond one of two ways. They either
They're
get
either
really self-focused and freak out, and I think there's a lot of people that are doing that right now to some extent, especially because they're just at home trapped.
Right.
But the way to get out of that is to go help somebody, in the best way that you can. And I see a lot of people trying to do that. I always tell, if you don't want to be selfish, try acting like someone who's selfless.
Right.
And you'd be surprised how doing some of that stuff makes a huge difference.
Manny, do we have any comments, questions?
We actually
Remarks?
had Shannon Scott chime in. Great job, Brian, and the Principal LED team for creating this amazing and innovative product. It's his LED machine. And then Rachel Juarez says, thank you, Joe, for doing this interview. Lots of great info. And then Janice Pierce-Backum, thank you, Brian, for all you are doing for us. So, yeah, we've had a lot of great interaction this afternoon.
Well, we're glad we can help the community. I love San Angelo, man. I'm a San Angelo guy. I choose
You're
to
not
have my
gonna move
business
to
here.
Braun?
I'm not moving to Braun. I'm not moving. I'm certainly not leaving Texas,
There you go.
So, I'm a Texan through and through. And, I'm proud of the state. And I'm proud of it's real easy to play politics. I can't imagine the kind of things our governor, our leaders, even our mayor is having to make decisions that can potentially impact lives. I mean, nobody wants to have to make those kinds of decisions. So, as much as we can pray for them and support them, regardless of whether you voted for them or how you feel about anybody, I think right now is the time to come together and let's do what we can to help, be a good Samaritan, help those people around us.
Right.
So,
And keep your antenna up.
yes,
And
wear a mask.
Wear a mask. All right, so the mask should be here tomorrow,
Well, some of these will be here tomorrow.
and tomorrow would be the 14th of April.
14th of April. Last I checked, these had shipped. I don't have tracking yet, but we're thinking it's going to be about 5 to 7 days. So we're hoping that early next week, they'll be here and ready to start being distributed to the community.
And we'll put it up on San Angelo Live how to get one of these free masks.
Yeah, and I think the mayor has put a team together, and they're going to be working really hard to
Get distribution points.
get distribution points. And I almost didn't want to do this interview because I hate having to do something like this until the product is sitting on my warehouse floor. But
So if it doesn't show up,
we're gonna be scrambling.
hopefully
but,
the plane doesn't crash.
right. Hopefully. Well, it's just with customs and all kinds of things going on.
Right.
It's a bit chaotic in our supply chain right now. So. That's creating kind of a little bit of nervousness.
We'll keep people updated about where
Yeah.
the masks are.
Thank you.
How's that?
Thank
That way
you, Joe.
that people will know.
Perfect.
But anyway, Brian, it's been a pleasure to talk to you. I know we
you.
went way over our time, but it was interesting. And I think it's important to know what business leaders in San Angelo are doing. We talk to politicians all the time. So,
Hey, business people, we can't depend on government to solve all our problems. Those of you who have the resources and the means, and you're a business person, step up. You've been blessed. Figure out how you can help.
right. Brian Vincent over here from Principal LED, one of the premier businesses in San Angelo, creates LED lights for all the Love's convenience stores. How's that?
That's great. Thank you.
Thank y'all for joining us.